Everyone. The lecture for the today's topic is regarding axilla. I'll mention about boundaries and content of axilla. Axilla is also known as armpit. It is a fat-filled pyramidal space which is situated between the upper arm and the chest wall, which consists of boundaries that is known as apex, base, forewall, anterior, posterior, medial and the lateral wall. You can see here in the diagram at the top this is known as the apex, this is known as the medial wall, lateral wall, the floor, and again we have the anterior and the posterior wall. Here also the green color area is indicating the boundaries of the axilla. Let's know about the apex. Can see here in the diagram this is known as the apex, which is directed upwards and medially towards the neck. It is not pointed, it is truncated. So we have the boundaries. Anteriorly it is formed by the clavicle. In the posterior aspect it is formed by a superior border of clavicle. In the medial aspect it is formed by outer border of first rib. This apex is also known as cervicoaxillary canal because the neurovascular bundles will pass through the apex, so which consists of the brachial plexus, the axillary artery, it can be axillary vein also. Now we have the term known as the base. Base is directed downwards and it is formed with the help of skin and axillary fascia. Same how we have to know about the two folds which is present near the axilla, that is known as anterior axillary fold and posterior axillary fold. Anterior axillary fold is formed by the pectoralis major muscle and the posterior axillary fold is formed by latissimus dorsi and teres major muscles. This is known as horizontal section of the right side of axilla. So let's know the formation of anterior wall of the axilla and the posterior wall of the axilla. Anterior wall is formed by the pectoralis major, and you can see here in the diagram by the clavipectoral fascia. Then deep to the pectoralis major we have pectoralis minor, and we have one more muscles that is known as subclavius muscles. On the back side you can see here in the diagram it is formed by subscapularis muscles above, and little bit below it is formed by the teres major and by the latissimus dorsi muscle. The medial wall of the axilla is formed by the upper four ribs. Can see here in the diagram first, second, third and the fourth ribs, as well as the intercostal muscles present between the ribs, and we have the upper part of the serratus anterior. Even you can see here by the ribs and the serratus anterior muscles. The lateral wall is formed by the upper part of the shaft of the humerus, and we have the two muscles that is known as coracobrachialis, and we have the short head of the biceps. So all these three structure is forming the lateral wall of the axilla. You can see here in the diagram, if this is known as the humerus bone, so this is known as the shaft of the humerus. Above we have the coracoid process. From the coracoid process the two muscles will get originated, that is known as coracobrachialis and short head of the biceps. That's why we can say this is forming the lateral wall of the axilla. Let's know about the content of axilla. This is known as the horizontal section of the axilla, and you can see here the red color, that is known as the axillary artery. Medial to that we have the axillary vein, and the axillary artery is surrounded with the help of the nerve that is known as the brachial plexus, and all this neurovascular bundle is surrounded with the help of the axillary sheath that you can see here in the below diagram. Now same how this is known as the serratus anterior muscles. So the serratus anterior muscle is also supplied by the nerve to serratus anterior or long thoracic nerve, which is also a content of the axilla. We have the lymph nodes which is present inside the axilla, as well as the axillary tail of the breast is also a content of the axilla. Let's know about the axillary vein which is present in the axilla. It is a continuation of the basalic vein, and at its terminal part it is also joined with the help of the cephalic vein. You can see here in the diagram this is known as the cephalic vein, which is passing through the deltopectoral group, and it pierces the clavipectoral fascia and finally goes and drains, or it opens into the axillary vein. Now we have to know the formation of the axillary vein. It is formed at the lower border of the teres major muscles by the union of the basilic vein and the veins which is running along with the brachial artery. So there are other small tributaries that is also draining into the axillary vein, that is known as the subscapular vein, circumflex humeral vein, lateral thoracic vein, and the thoracoacromium vein also. And if this is a first rib, near the first rib, right, it crosses and it continues as the subclavian vein. It is running along with the axillary artery, and we can include the clinical significance, that is thrombosis of the axillary vein takes place. Let's know the axillary lymph nodes. There are 5 groups of the axillary lymph nodes, that is known as axillary anterior lymph nodes, posterior, lateral, central, and the apical. Even you can see here in the diagram, this is known as the anterior group, posterior, lateral, central part, and the finally the apical part. So can you see here, this anterior group of lymph nodes, it lies along with the lateral thoracic vessels, that is near the lower border of pectoralis minor, and it receives the lymph from the upper half of the anterior wall of the trunk and from the major part of the mammary gland. So we know the term about the axillary tail of the mammary gland is in actual contact with the anterior group of lymph nodes. Therefore, cancer involving the axillary tail of the breast may be misdiagnosed as enlarged lymph nodes. Now this is known as the posterior axillary lymph nodes. It lies along the subscapular vessels, that is near the posterior axillary fold, and it drains the posterior wall of the upper half of the trunk and the axillary tail of the breast also. Then we have the lateral lymph nodes. It lies along with the upper part of the humerus and receives the lymph from the upper limb. Then we have the central lymph nodes. It means it receives the lymph from the other lymph nodes, that is from the anterior, posterior, lateral, which goes and drains into the central lymph nodes, and finally from the central lymph nodes it goes and drains into the apical lymph nodes. Now the last one, that is known as apical lymph nodes, it lies deep to the clavipectoral fascia and receives the lymph from the central group of lymph nodes and from the upper part of the breast and from the thumb and its web space. Let's know about axillary artery. So it is a main artery which is present in the axilla. So before dealing with the axillary artery, let's know that this is known as the first rib. Can you say this is known as the inner border of the first rib, and this is known as the outer border of the first rib. Same, this is known as the pectoralis minor muscles, and this is known as the teres major muscle, right? So this axillary artery is a continuation of the subclavian artery, and which continues as brachial artery. Now we have to know that extent of the axillary artery. It extends from the outer border of the first rib to the lower border of the teres major muscles. Now this pectoralis minor muscles divide the axillary artery into 3 parts. Can you see here, this is pectoralis minor, which is crossing the axillary artery and it is inserted into the coracoid process, right? So this is known as the first part of the axillary artery, and deep to the pectoralis minor we have the second part, and below that one, this is known as the third part of the axillary artery. So from the first part, 1 branches will arise. From the second branch, or from the second part, the 2 branches will arise, and from the third part there are 3 branches which will arise from the axillary artery. So we have to know the mnemonics S, A, L, S, A, P as for superior thoracic artery. Then again, that is the arising from the first part. Then we have the artery that is known as A for acromion thoracic artery, or we can say thoracoacromion artery, and L for lateral thoracic artery. So these 2 branches, it is getting the originated from the second part of the axillary artery. Now we have the third part. From the third part, subscapular artery, anterior circumflex humeral artery, and one more artery that is known as posterior circumflex humeral artery. So can you see here in the diagram, this is the first part of the axillary artery. So can you see here in the diagram, this is the first part of the axillary artery. So we have the branch that is known as superior thoracic artery, also known as supreme thoracic artery. So this artery runs between the two the pectoral muscles, that is pectoralis major and the pectoralis minor muscles, and supply those muscles, as well as it also supplies to the thoracic wall of the axilla. The second artery is known as the thoracoacromial artery. So this thoracoacromial artery pierces the clavipectoral fascia, as you can see here in the diagram, and it breaks into 4 branches. So the 4 branches are the pectoral branch, deltoid branch, the acromial branch, and we have the clavicular branch. So the pectoral branch supplies to the pectoral muscles, that is both the pectoralis major and pectoralis minor. Deltoid branch and acromial branch goes an anastomosis near the acromion process of the scapula. And the fourth one, that is known as clavicular branch, it supplies to the sternoclavicular joint and to the subclavius muscles also. Then the third one, you can see here in the diagram, this is known as the long or known as lateral thoracic artery. It goes and supply to the pectoralis major and pectoralis minor, as well as to the serratus anterior muscles. It also goes and supply mostly to the mammary gland. You can see here in the diagram, this is known as the third part of the axillary artery. So the branches which is getting originated from the third part is known as subscapular artery. It is one of the largest branch of the axillary artery, and it ends near the inferior angle of the scapula. This is known as the subscapular artery. It gives the branch that is known as circumflex scapular artery and thoracic dorsal artery. The fourth artery is known as subscapular. Now we have the fifth artery that is known as anterior circumflex humeral artery, and the sixth one is known as the posterior circumflex humeral artery. You can see here in the diagram, this is known as the anterior circumflex humeral artery. So it passes in front of the surgical neck of the humerus and anastomosis with the again posterior circumflex humeral artery, that is near the surgical neck of humerus. It gives a branch that is known as ascending branch of the anterior circumflex humeral artery, which runs through the intertubercular sulcus of the humerus and goes and supply to the head of the humerus and to the shoulder joint. Same how posterior circumflex humeral artery, it is larger than the anterior circumflex humeral artery. It crosses the posterior aspect of surgical neck of the humerus, and again it also anastomosis with the anterior circumflex humeral artery. It supplies to the deltoid muscles and to the shoulder joint. Now let's know the relation of the axillary artery in the first part, in the second part, and in the third part with the muscles, with the veins, and with the branches, as well as with the trunk of the brachial plexus. So I have mentioned here the A means anterior aspect, on the back side this is posterior, M for medial aspect, and we have the lateral aspect. So in order to know the relation of the axillary artery, let's draw the axillary artery in the center part, and this vein that is known as axillary vein, that is always in the medial aspect. So in the first part also you can see here the axillary vein is medial to the axillary artery. In the second part also the axillary vein is medial to the axillary artery, and in the third part also the vein is medial to the axillary artery. Now let's know the relation. In the anterior part, it is having relation with the skin, superficial fascia, and we have the muscles that is known as the pectoralis major muscles, as well as we have the loop of communications between the medial and the lateral pectoral nerve, which is forming the anterior relations of the first part of axillary artery. Somehow, in the medial aspect, we have the axillary vein, and in the back side or in the posterior aspect, we have the muscles that is known as the first digitation of the serratus anterior muscles, as well as the long thoracic nerve, because this long thoracic nerve will be supplying to the serratus anterior muscles. That's why it is also forming the relation that is the posterior relation of the axillary artery, as well as we have the medial cord of the brachial plexus also, which forming the posterior relation of the first part of the axillary artery. Now same how we have the lateral relations. So lateral relation is by the lateral cord of the brachial plexus and by the posterior cord of the brachial plexus. So these all are the relation of the first part of the axillary artery. Now let's know the relation of the second part of the axillary artery. Anteriorly we have again the pectoralis major, pectoralis minor. On the back side or in the posterior aspect we have the subscapularis muscles as well as the posterior cord of the brachial plexus. In the medial aspect, axillary vein and the medial cord of the brachial plexus, and in the lateral aspect again the lateral cord of the brachial plexus. Because the brachial plexus is having three cords, that is medial, lateral and the posterior cord of the brachial plexus. Now let's know the relation of the axillary artery in the third part. So in the third part, that is in the anterior aspect, we have the medial root of the median nerve. On the back side or in the posterior aspect, now this posterior cord will give the branches that is known as axillary nerve and the radial nerve. That's why the axillary nerve and the radial nerve as well as subscapularis muscles and teres major muscles is forming the posterior relation of the axillary artery. Now we have the lateral and the medial relations. The lateral relation is formed by the musculocutaneous nerve and the medial relation is formed by the medial cutaneous nerve of the forearm, ulnar nerve, then we have the axillary vein and medial cutaneous nerve of the arm. These all are the same relation which I have mentioned in the previous slides. Let's know some of the clinical aspect related with the axilla. So there is a term known as collateral circulation through the scapular anastomosis. It means if there is a blockage in the subclavian artery or in the axillary artery, so there is a collateral circulation takes place near the scapular region and the circulation of the blood takes place. Same how there can be a thrombosis of the axillary vein also. Now there is a term known as the palpation of the axillary lymph nodes. The palpation of the axillary lymph nodes is a part of clinical examination of the mammary gland or the breast due to their involvement in the carcinoma of the breast. So there is a term again known as the axillary abscesses. It means an abscesses in the axilla which arise from the infections, right, of the axillary lymph nodes. The abscesses may grow to the particular size before the patient feel the pain. The pus of the axillary abscesses may track into the neck or into the arm also if it enters the axillary sheath or between the pectoralis major muscles if it breaks through the clavipectoral fascia. Now, the axillary abscesses is drained by giving an incision in the floor of the axilla or near the base of the axilla, for it being the most dependent part, that is midway between the anterior and posterior axillary fold, that is nearer to the medial wall to avoid the injuries of the main vessels running along the anterior, posterior and the lateral wall of the axilla. The other clinical aspect we can include boils, that is near the armpit. The boils can be caused by the condition is known as the hidradenitis, which is caused by the blockage of the hair follicles that is present near the axilla. There can be also a pus formation in the axilla. Now one more, the syndrome that is known as thoracic outlet syndromes can take place, that is compression of the vessels and the nerves in the apex of the axilla. That is most commonly due to the fracture of the clavicle, because clavicle is forming the anterior boundary of the apex. Same how there is term known as lymph nodes biopsy, right? So if there is a carcinoma of the mammary gland, we need to confirm which type of carcinoma is there. So the biopsy is taken from the lymph nodes to confirm the cancer and its the spreading pattern. So this is known as axillary
the clearance. It means if there is a cancer of the lymph nodes, we need to remove that one. That is known as the axillary clearance. So during this procedure, the long thoracic nerve can be also damaged and resulting in winging of scapula.